all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Mikelle Moore, who is the founder of Multiplier Advisors. Thanks so much for joining us.
Thanks for having me, Stephanie and Apoorv. I'm glad to be here with you.
We're excited to talk to you, and we had a really fun conversation in our pre-interview and learned a lot. You had a long career for almost 25 years at Intermountain Health. You're an executive in residence at Scottsdale Institute, and then you several years ago co-founded Multiplier Advisors, where you work with health systems, and you're really proud about being a loving leader, which is something that, Porv is very passionate about too, finding loving organizations, and we like to feature on the show. And so you said a couple of things that I really loved. You talked about the different worlds that you've lived in for your career. And you also said that you serve on boards for nonprofits. And so you talked about the difference between governance and leadership and advising. But ultimately, there's a thread between all of those worlds. So even if they need different treatment, you said that there still is a thread. So why don't you tell us about that? What are the common themes and the differences dealing with those worlds where you've built your career?
There's a lot to talk about there. And, I guess what I would say is, I think I learned leadership by doing and had wonderful mentors that shaped the way I developed as a leader. And I probably leaned into those mentors who had that type of leadership that I wanted to emulate. Approachable, able to communicate a vision, willing to explain the reason behind really difficult decisions and create transparency. And so I think I first learned leadership as a way to be a loving leader. And along the way, began to serve on boards where that distinction between leadership and governance was something I was also looking to learn. And while at Intermountain, I was on a couple of our boards because of my executive position, and also leading boards where I was helping to recruit board members to then sit on our boards and govern, while I was also serving on these boards in our community, and really began to understand that your opportunity to be a loving leader as a trustee is really different than your opportunity to be a loving leader in leadership. And your core responsibility is to be that loving leader to the CEO, because the board's job is strategy, hiring the CEO, fiduciary governance. There really isn't a role for creating love all the way through to the people delivering care or delivering a service, or even those being served by the organization. But how valuable to create that loving relationship with the leader who, flip back to my leadership hat. Leadership can be really lonely. Often the leader has no one to turn to express their concerns, express their fears, what's keeping them up at night. And being that trustee who can create a loving relationship that allows for that same transparency, approachability, thinking things through together, I think is really valuable. And now bring that all forward to my role in Multiplier Advisors. We really try to match what our clients need. And typically they're thinking about how to develop a cohesive impact strategy. So they're thinking really about strategic plan development, assessing their assets, looking at tactics that could be deployed more effectively, and then how to measure their impact. That's what they tell us they need. What we end up learning along the way is that they also need loving leadership, mentorship, a safe space to talk about their aspirations, their hopes, their worries, their fears, the difficulty in trying to align siloed parts of their organization to work cohesively in a common direction. And then that becomes a loving relationship. So it's interesting. Every role is a little bit different, but it all requires some of the same, I think, the same behaviors and principles.
Wow. Well, Mikkel, I'm just kind of soaking that in because I think you're teasing out a number of things that I don't know if I've really thought about, and I'd love to explore those a little bit more with you here. Specifically, you talked about how leadership can be lonely, and we do hear about that a lot. I guess I've always sort of taken that as just a truthism, or maybe just a way of talking about, the reality on the ground. But I don't think I really made the connection between that and maybe what prevents a leader themselves from finding the love inside them if they're experiencing leadership as a lonely journey. And so, what I would love to hear more from you and I don't know if it's based on your experience or maybe just surmising, do you think that the because leadership is can be lonely, is that part of what the barrier you think might be to loving leadership?
Oh, that's really, I don't know that I have ever thought about that. So let's think about it together. Um, when I've been in leadership and felt lonely, the the path towards dissipating that loneliness for me was always seeking mentorship and guidance from people I trusted. And that uh, facilitating that relationship of trust is an action. It doesn't happen just because you're a leader, right? You don't have mentors or guides unless you foster that relationship of trust. And so, yes, I think you're probably much more likely to lead with relationships and behaviors that build trust and love if you're also willing to invest in that for your own support, because
Mm.
it's work to have mentors. It's maybe easier to have mentors when you're young in your career, right? You have bosses, you have people that um, professors or others who have been in natural guidance positions for you to seek out that relationship of guidance. When you're the leader, I think that and I've observed this so many times, whether it was in peer leaders or in organizations I'm advising now, where there's different leaders over different silos or parts of the organization, there's this desire to prove that you've got this. I know, I know my area of expertise. I want to appear confident, particularly to my board that's hiring me. Um, and so there's fear of developing a relationship that includes asking for advice, sharing concerns, because that can be perceived as a signal of inability. And I think that fear probably is the similar fear to engaging as a loving leader.
Mm.
But
Wow.
I don't know.
Yeah, I love that you're willing to explore this here with us because again, I'm also exploring it for the first time. Again, just having heard it but haven't really thought about it. It brings up another question for me, which is that should the responsibility then for that leader to to become more loving, should it fall on the leader themselves, the CEO? And because we think in systems, we think, well, could the board set up a system? Such as maybe what you set up when you started talking about, well, now as a trustee, you had to kind of be that loving anchor for that loving leader. And I just wonder, maybe the board, could they think differently about how they set up such a system to kind of create that kind of communication, trusting, relationship-based mechanisms around their leader so that it's not all coming back to me and now I got to figure it out. And I'm trying to prove myself and I don't know how to do it. So maybe can you tease that out a little bit more? It's like, what should the board relationship particularly be? And could you see a systems oriented way of creating that for the CEO?
I think as you're asking that question about several instances where I think that's exactly what a board was trying to do. Um, and I can think about it within my Intermountain experience. I can see it now with a board I serve on, where there's an awareness at the trustee level that the leader or some subset of leadership, important executive leadership within the organization isn't showing up in a loving way, and that there's an opportunity to improve the upon the mission of the organization by guiding the organization more towards behaving as a loving organization, to use your terminology. And the board very much can and has, I think, in the examples I've seen, create systems that move the organization in that direction. Certainly, looking at um, leadership development, even for the CEO, is an important part of that process. So, whether that's 360 evaluations, performance evaluations, understanding the way this leader shows up informs, but then what does the board do with that? And in the case of, sort of at the outset, the board does influence the values of the mission, vision, values of the organization, which establishes some of those behaviors that are important for creating loving leadership, and through its governance can think about the work of different board committees to create accountability around living the mission, vision, and values. So, at the highest level, the board has the opportunity to determine that aspect of leadership. I think in the softer way, the board has the opportunity to show this to the CEO, right? If I'm particularly the chair of the board or a well experienced trustee, um, I I can facilitate those conversations with the CEO about what they need from me as their boss that creates the example for what I'm looking for in their leadership. And those signals really matter. And I've even been told that joining a board, one of the reasons I was asked to join was to create, to foster improved trust and openness, communication, the EQ abilities of the CEO.
How often do you encounter people who are in those leadership positions or maybe in board positions that believe that because they really want to see the genuine change versus believe that because that's what results are telling them? Where is that line that you're sensing of the people that you work with for, is there real interest in change for genuine reasons, and do those people have better results if so?
Absolutely. I think whenever you have a leader who, or trustees who truly believe that the success of the organization is determined by the engagement of the caregivers in the case of a healthcare organization, or the engagement of the teachers. I'm incoming board chair for a school. I think it's when the leader recognizes that engagement translates to engagement of the patient, the consumer, the student, it's much easier to make that change. And I think so it's easier when leadership gets it. It's also easiest when the board gets it. And results are measured in a comprehensive scorecard where finances, those things that tend to be easier for people to measure on a monthly basis, when they're balanced by engagement scores, satisfaction scores, leadership engagement. I think whenever there's a commitment, either by the board or by leadership, that these things matter, it's more likely to happen. Absolutely.
Love to hear about this. I think, Stephanie, we have not had a conversation at this level, so it almost feels like a privilege to be able to get into the head of someone who's been in these multiple roles and is able to then connect the dots. So, Mikhail, super valuable, great insights. And where my head is now going is to a conversation that you and I had before
Mhm.
today, where we were talking about your journey in in this large health system, amazingly renowned. I guess it's not a secret. I don't know why I'm talking about it that way, but Intermountain Health. It's
Sure.
the one of the paradigms of excellence that all of us think about in healthcare. It's on the short list of what are the best health systems in the country, and Intermountain's always on that list. And we talked about your journey there and how you were able to actually craft again, in your words, you might have called it something else, but what we would call a loving organization, because you were the person in charge of that hospital, and how you were able to get that build that organization out, and yet also how it was challenging when you were in another role in the same organization because other challenges, other barriers, came up. So I'm hoping that you can maybe frame up a little bit of that dynamic for our audience as well, how it worked because you were the leader in charge and were able to drive a particular vision, and how it may not have worked in other settings.
Well, thanks. I mentioned that I was drawn to Intermountain because of its strong commitment to mission, and and that's really true. The mission of Intermountain Health is helping people live the healthiest lives possible, and it's evolved a little bit since I started at the organization. But I felt that commitment through and through amongst its leaders when I first interviewed here in Salt Lake City, and um, yet living a mission becomes different as you work your way up in an organization in terms of what you feel are your day-to-day pressures. And I really had to learn what that meant for me in different leadership roles in the organization. And there was a really pivotal leadership moment for me in that feels now like it was so long ago. I feel like a really old woman talking about it. And yet it's something that I always think about and go back to when I'm struggling with my leadership, um, because it was something that, it was probably the hardest leadership moment I've ever had, ever will have. And it was, I led the flagship hospital for Intermountain during a time when it was becoming a community hospital because we were opening a new flagship facility. And, that's a very long process because you're building the hospital. Their eyes are on the new hospital. And yet my job was to think about the physical redesign of the former flagship, what the medical staff would look like, what the leadership would look like. And it wasn't the shiny object. It was the stalwart facility in the community. So we went through a process. It was really fun to engage people and get their vision. After all of that planning, our planning assumptions weren't 100% correct, which we knew they weren't going to be, right? But we had to make some really difficult decisions about um, our staffing model, structure, and other things at a time when the organization was otherwise really healthy. There had never been any reductions in force for at the time that anyone could remember. There had not been reductions in force at Intermountain, and we were in a position where we needed to in order to have the hospital succeed. And my leadership team had come together over the course of about a month. We'd been really um, thinking through how to approach this big process of reducing 150 FTEs. I mean, a lot of people out of our organization, and um, we needed to make the changes pretty quickly in order to have the financial turnaround that was necessary to sustain the hospital. And so the team had really become very insular. We had, the typical CFO, COO, HR, communications, physician leadership, nurse leadership around the table, thinking about how to do this. And our corporate leadership was asking for how we were going to get there, what number could we hit by when, and we had it all sort of mapped out. And I went to a mentor of mine within the system and shared with him that I was really uncomfortable delivering a result to this leadership team, that over the course of the last 3 years, I had been kind of cultivating those next leaders at Intermountain, right? They weren't going to be leaders at the new shiny hospital. They were going to step into leadership for the first time at this community hospital. And I'd really asked them to bet on us, to bet on this hospital being able to be a very dedicated community hospital. And our physician leaders, the same way, I had cultivated people who had never led in physician leadership to be at the table. And here I was going to come to them with, here's a solution that our team has come up with, and I expect them to help me implement it. And yet they haven't been able to design it because we've needed to deliver results and an answer, a full solution within a tight time frame. And this mentor said, well, have you pushed back? Have you said you're going to commit to doing something different and show leadership the way? So it sparked in me that, yes, we can lead this in a different way. And I went back to my leadership team an hour later, convened them. We stayed late that night, and we thought about how would we do this in a completely transparent way, where we presented where we need to be 6 months from now. Just argue that we need more time, and that we want to engage our leadership team in defining the solution together. And how would we do that? What would our asks need to be? Oh, and by the way, if we have 6 months, couldn't we redeploy every one of those 150 FTEs? People represented a lot more people, 250 people. Couldn't we redeploy them somewhere within Intermountain? Because we hire way more than that in that amount of time. So let's go for gold here. Let's not go for silver in terms of what would work. And we built out a plan, presented to our corporate leaders, and got their buy-in. And then we went to the team and we announced it, and everyone had our backs. We did that work as a team. We showed care and concern. We expressed apology to our team for getting it wrong, making the wrong projections, and then we worked together for figuring it out. And it was that was by far my biggest lesson I didn't call it loving leadership. I thought of it as being vulnerable, transparency, but setting a clear vision, being optimistic, but listening and inviting people to express their ideas productively.
What gave you the bravery to go do that? Because that is a big pivot when you're expected to deliver, okay, we need to find a way to offboard 150 people. And then you say, oh, let's try this other thing. And to get them on board, first of all, they must have had trust in you already. But what gives you the bravery to do that, to know that, okay, I have a plan, we can do this? And then what was that journey like for those 6 months? Where were you after that?
Well, I think what gave me the bravery was, first of all, that mentor that gave me the prompt to think that way was also a trusted leader in the corporate office. And so maybe if it had been someone else, I would have needed to foster some more of that support. But I also went to my direct leader and shared the idea very quickly, and got his support that at least I could try this, flesh it out a little bit, get some detail. So that gave me bravery. What also gave me bravery is I developed a few data points around what would make it work. First of all, 6 months, continuing to operate as we were for 6 months while we built the plan wasn't ideal if you look at the performance of a singular hospital, but we're part of a big system. And we were a part of a region as well, and we could manage it. So one, I knew it was reasonable financially for the overall institution. It wasn't putting the organization at risk. Two, I knew it was possible from a people perspective. I knew with the amount of hiring we were doing across the system that we could thoughtfully move these wonderful resources that we have in the human beings that work for us thoughtfully, and that would be doable. So I used facts sort of to give me bravery, and also coalition building amongst some of those key leaders. So that's what gave me bravery. The second thing, as soon as I had, I can remember where I was sitting talking with my leadership team. When I said this to all of them, they believed it was possible. And they were worried, but they believed and they were hopeful, and they really wanted to do it. So I think that gave us the bravery that we needed. The 6 months were long. I mean, they were long, and it was really important how we conducted ourselves during those 6 months, and we established some ground rules. We were going to, every leader was going to have access to all the information about what every other leader was thinking their budget, their future budget should be, their future staffing model. Nothing was in the dark, so that they could feel comfortable challenging each other in nice ways. I mean, these were people that they knew they were going to continue to work together, but they could ask questions about how they could collaborate. They knew we were looking for a collective goal, not an individual goal. We didn't say, Perv, your goal is this. Stephanie, your goal is this. We said our aggregate goal is this. So that gives you the ability to find ways to do things differently than you've ever done them before. You can collaborate with another department. You can reassign work. You can think differently. And we kept that in front of them. It was updated every week. It was visible to all of the leaders. We also, every week, held meetings that were open to all of our medical staff, anyone in our team that worked in the hospital. Where were we? How were we progressing to our goal? What issues were coming up in the meantime? And we answered questions. Any question was fair game. And we did that every week. It was a little bit exhausting, but worthwhile.
Yeah, remarkable model. Actually, it sounds like model after model. I was going to say, it feels like you almost gave the organization a blueprint for carrying this out. I don't know. Do you think that the organization in other times of need was also able to implement something similar? And therefore, now this became kind of an Intermountain way of doing it?
I think so. I think, it also wasn't all our idea, right? It was also informed by the way Intermountain behaved as an organization leading into that time. And, I can think back to the quality improvement work around and patient engagement work around rounding and listening. And, a lot of those things were percolating around the organization at the time as well. And as we moved out of that sort of 6-month crisis and into operations, we really incorporated some of the lessons learned from the process into our ongoing operations. And so did Intermountain, rounding, holding forums, open forums for people to talk and learn about both hear the strategic direction of the organization from its leaders, create that opportunity for articulating a vision and having it heard by all people in an organization, but then also ask questions, and any question goes. That culture was something we really worked to build, and it was very much a part of, as Intermountain built its operating model in subsequent years, the idea of having huddles at every level of the organization, creating that mechanism for cascading of vision, but then cascading of observations and experiences at the front line was really an important part of what evolved as Intermountain culture as well.
This conversation has really gone deep and broad, and I think we're exploring areas that are really new to me, and maybe even Mikelle, as you were saying, you were also thinking about some for the first time. I think one area that we really haven't gotten to at all is the what you're doing now with
Yeah.
Multiplier Advisors. I feel like that's taking it all to another level. As you know, we talk and are inspired by finding loving organization exemplars. And we have, the whole systems-based approach. We're trying to identify that. One of those systems is community, which is where we see a lot of organizations are probably have the greatest challenge is figuring out how to bring the love from outside the walls into the community. And I feel like that's what you're really doing now in your current iteration. So I'd love to hear more about how is that community aspect now developing for you, and what was your vision around it? Why did you decide to co-found Multiplier Advisors?
Well, I mentioned that in the latter half of my career at Intermountain, I was doing a lot of community partnership building, connecting the community voice to inform the way we designed our charity care policy, the way we improved population health outcomes, the way we engaged community-based organizations and government partners to help us do the work. And I loved what I was able to create at Intermountain, and I wanted to have impact beyond one health system. So that was the impetus for creating Multiplier Advisors. We advise health systems and health foundations in thinking about how to align their resources to improve population health outcomes, particularly for the most vulnerable communities. And so when we are advising health systems and health foundations, we're thinking a lot about how do you connect that community voice, the community need, to the strategy of the organization. So all health systems that are nonprofit are required to perform a community health needs assessment. Sometimes that's performative. That's being able to check the box on a 990 tax form. But for an organization that really lives its mission authentically, it's a genuine process of listening to those community needs, ensuring that the voice of community is informing that needs assessment and then a health improvement plan. What Multiplier does is try to take that to the next level. How are you not just thinking about your community health improvement plan through the lens of maybe a community health team, but how are you thinking about all the assets you have as a system? You have investments, you have purchasing power, you employ a lot of people, and you own a lot of real estate. How are you engaging those community members, or at least the community needs? How are those informing the way that you're behaving as an organization with some of your business practices? And that really builds a great foundation for then informing the clinical care delivery. If you're employing more people from the most vulnerable parts of your community where there's underemployment, you're getting the community into your organization in a different way. If you're making investments locally that help economic advancement, availability of affordable housing and other things, you're investing in the needs of your community in a different way. So we're really working with systems and foundations to think about how they put more of their resources in alignment with mission as informed by what the needs are in their community.
Love it. Thank you.
That was fantastic. Thank you so much for sharing this. This was really an enlightening conversation about leadership that, as Apoorv said, spanned all areas. We were so thankful to have this conversation with you. We appreciate your time.
Well, thank you. I appreciate the opportunity to be with you.
So grateful. Thank you, Mikelle, for joining us.
Thanks for what you do.
And thank you all for watching. We'll talk to you soon. Bye-bye.